Hi and welcome to KCBD.com. My name is Dr. Roberta Beals and I'm coming to you today from Healthy Skin Clinic located inside Grace Clinic on Marcia Sharp Freeway. Today we're going to be talking about a couple of procedures we do in our office for our patients wanting to make changes in their life and lifestyle. And he's also concerned about the lumps on her skin, as she calls them, and what they are thickening of the skin cells due to sun damage. And we've elected to do the micropin because by doing the micropin we can penetrate the dermis to the target tissue and provide medication that will help her heal up her skin. The dermapin there's lots of different treatments available. We use the Eclipse and we put some peptide ointment on top of the skin while we do our treatment. We do 2 passes. We do different depth depending on the amount of damage in the skin. And after the treatment, you can see she has a little pinpoint bleeding. But that is your target for these procedures. And after we wipe it off and put some vitamin C on top, the skin will absorb that and remodel her skin from within. And as you can see, she swells a little bit in the areas where we do more treatment around the nasolabial fold, especially on her left side. And she did really well, and she's very happy with the treatment outcomes. Post-op, all we have to do is put some sunblock on, and she can go about her day. After her treatment, she may experience some very light peeling, just as if she had some rough, dry skin, and she's instructed to use her ointment and moisture cream every 2 to 3 hours to keep that at bay. You just kind of go across, and then I recheck, so you can see this is deep enough, okay? You want pinpoint bleeding to go through there, because that's opening up the holes. And how discomfort are you? Are you doing okay?
Oh yeah, I'm doing good.
Okay, so we're going to continue this on. You doing okay? Mm-hmm. Okay. Now the other thing is she's got some topical numbing medicine on here, but I put it on there twice, so I have to make sure she's doing okay as far as being too drowsy. Because some people are more sensitive to topical numbing medicine. So I'm just barely applying this to her forehead, and so and I'm sure you can see in the camera, she's just sucked up all this gel on top, and it's going into her skin. And I'm going to apply it again after we treat her. We're going to do the other side now. So it's pretty quick. You just take your time, go across. This is nice because, again, there's no downtime here. And I'm not putting any pressure on this. I'm barely holding this on her face. So we do 2 passes. Second one's a lot faster. You can hear the water, the medicine in there, can't you? So that's good. That's what I want. I like to hear that. Kind of scary that second time about when you hear that, because you don't hear it on the first one. It's just getting up in the, you all right? Mm-hmm. It's just getting up in the side of it so you can see. And we're going to change that needle out. So here, let you absorb all that, and then I'll blow it dry.
Mm-hmm. Okay, I gotta run. I gotta be somewhere in about 2 minutes.
Now if you look at her forehead now, there's no more bleeding. You can see that it just was a temporary thing. And she's just nice pink. And then we'll put sunblock on that, and she'll leave after this treatment today. This doesn't hurt?
Mm-mm.
Okay. All right. Now I'm going to go a little deeper now.
Mm-hmm.
Okay, because we're in her cheeks. Oh, that looks good.
It's not bad at all.
Huh?
It doesn't hurt at all.
Okay. That's what I like to hear. We don't want anybody suffering here. Pain control is really important when you're doing a procedure. I don't care whether it's taking off a skin lesion for a biopsy or doing one for aesthetics. Very good. So with this procedure, you would want your skin to tighten up and to get rid of inclusions, because we're basically drilling holes into your face in hopes of having your body heal itself out. Now tuck your lower lip in. And our body is the best at healing from the inside out. We're going to do your upper lip now. Okay, tuck that in. There you go. Okay. This is where you have all those spots that I want to make sure. That's why she has a tendency to bleed a little bit more here, because she has a lot more to get rid of. So you can really see the depth of the needle is the same as it was on this side, but you can tell she has a lot more changes here on this side that need to be taken care of. Go ahead and turn over. So we like to tailor our treatments to our patient's needs here, instead of just doing one blanket treatment for everybody, because none of us are the same. We're similar, but not the same. You did really good, Sue. I'm gonna come up here. Okay, we can go down. Because even looking at this side of her face, the settings are all the same. This is where she has sun damage. So this is the area I'm going to target extra as soon as I'm done with this, okay? So we're going to remove this and come back again. Maybe not so deep, but definitely in that area. Come off just a little bit. All right, I still have to do your nose. So this is called extra passing, and it's just to give more holes in there for her body to get rid of it. Good. I'm going to let that rest for a minute and do her nose. You can feel the roughness. I can, I'm sure you can too, right through here.
Mm-hmm.
Yeah. Okay, very good. You all right?
Mm-hmm.
I'm going to do a second pass on the other side. Oh yeah, you're going already, aren't you? This side. Yeah, any treatment around the nose can trigger those. All right, let's see how you're doing. So now that she's done here, and I don't know if you can see it on the video, but definitely. I can. The skin is equal. You can see she's swelling a little bit here, which is a good clinical endpoint. She's got diffuse skin changes that are symmetrical, and all the brown is gone from the previous treatment. This is a mole, it will stay. It looks like I need to do a couple more passes down here, but you can see this whole general region, which is where we have a lot of inclusions and adolescence and other damages as we age. She had a really good response. So what we want is, we've got open holes here that are going to go in and fortify the skin underneath and the tissue underneath. So you're just giving it a great way to treat inflammation. And so we have definitely inflamed her with this treatment. And so she's soaking this in really good. So the previous ointment was an amino acid peptide. So she's got amino acid base so that her skin can grow itself back. And then we put the vitamin C to decrease any inflammation, infections that you may have, like from P. acne or Staph aureus. And This is very UV light sensitive, so we'll make sure we put sunblock on so it doesn't deteriorate from what we've done today. And Annie, can you tell me what you told me just a few minutes ago on how it feels right now?
Just a little bit, like a little bit sunburny. But, yeah, it feels really good other than that.
So this is not clear like the emollient. This is more of a cream base. And I put it on this way because it feels better. And I don't have any clinical outcomes that says it's any better than using one or the other, but there are clinical outcomes that show that if you use it post-treatment, it's very, very effective. So
it feels nice.
Yeah. This one has a little pigment in it so you don't look so white. But there's lots of different products available. Elta MD is the one I use here in my clinic because it's hypoallergenic and it's safe and reasonably priced. I didn't do in between here, between your eyes, so you look like you've been out on the water because you didn't have any damage there. So you can see it looks really funny on her now, but it'll go in. She will peel for about 4 to 5 days. And this is just going to be a superficial peel. And if anybody's had any procedures before, they understand the difference. But it'll be just like a rough, dry skin is what it'll be for someone that doesn't know what it's like. And you just want to keep it hydrated with your favorite moisturizer and covered with sunblock when you're outside. It requires repeat treatment probably every couple of 2 to 3 hours for the first day, and then after that, you know, just your usual. Thanks for checking out our video. Call or contact our office through email or phone, and you can never tell when we're going to have a special, so it might be a tattoo removal or one of our other procedures that are available on our website.